Alright, so this is the clinical anatomy portion of Module 8, the presentation. The system that I decided to go over was the skeletal system. It's easiest because I have a visual representation here. There are a couple different specialities that are associated with the skeletal system, biggest one being the orthopedics. They fix they repair bone breaks and make sure that everything is healing properly, so you don't have any abnormalities or disabilities or disformations after the bone is broken. Another one has to do with oncology. The oncology portion is pretty much present in all of the organ systems, because you can have cancer pretty much anywhere. With oncology specifically, it's more to do with the bone marrow and the ability to do a bone marrow transplant. So we move on to the specific organ in the system, which I chose the femur, because we have to label 5 different landmarks, and this has, in my opinion, the most. It is inferior to the pubic bones and superior to the fibula and tibia. Also, it is deep, obviously, to the skin and muscle tissue. It is a supporting organ system, so it supports the function of the muscles. There are different attachment sites of the femur. The greater trochanter is actually the attachment site of the vastus lateralis. The other thing is the neck of the femur. This is lateral and posterior to the head of the femur. The head of the femur actually, it fits in a ball and socket formation in the acetabulum. The next thing is the lesser trochanter in the inner portion of the more medial portion of the body. Then we have the shaft of the body as well. And then the function of the skeletal system is to provide structure so that we aren't a gelatinous form. We actually have the ability to stand upright, and we have insertion points for origin and insertion points for our muscles, and they are also innervated with a bunch of different nerves, so that if you do break a bone, you can feel it, as well as blood vessels. They all need blood supply. Obviously, the blood comes from the bones primarily. And that is our presentation on the skeletal system.